something that every parent should know in pediatric age group is a phenomena called MISC, which is nothing but Multisystem Inflammatory Syndrome in children. It happens when a child is COVID positive, either in the form of a COVID antigen, RT-PCR, or COVID antibodies, which was in the past. Then after that, there should be an inflammatory marker should be positive, and a child should clinically have fever with two of the following symptoms, which can include either a rash, any mucocutaneous symptoms like either oral ulcers, then the child can have any bleeding manifestations or coagulopathy or altered blood profile. There can be signs of shock, and there can also be signs of any cardiac decompensation and myocardial involvement. So it is very important for a child to undergo an ECG as well once the child is admitted. When the child is admitted and you do an ECG, you can find the QT interval, and the QT interval prolongation indicates towards myocardial problems, which would need a further evaluation and echo, and that also decides whether the child fits into the criteria of MISC or not. Once the child is diagnosed with MISC, the treatment management changes, where the child has to undergo investigations, and the treatment includes intravenous immunoglobulin at 2 grams per kg for 5 days and methylprednisolone. The follow-up of the child will take longer, and even after 10 days and the child improves and we discharge the child, you have to bring the child after 2 weeks and 6 weeks for a repeat follow-up echo, and also monitor the child and the blood markers periodically. When the treatment, when it comes to treatment of mild and moderate COVID, the management is for any other respiratory distress and disease, where you connect the child with oxygen, then you give IV antibiotics. In COVID, IV steroids or oral steroids have a very good role and tend to reduce the inflammation. Periodic monitoring for COVID markers is very imperative, and if the child develops a full-blown MISC, at that time the child might need heparin and intravenous immunoglobulin. The role of remdesivir in children is more towards mild and moderate disease. Remdesivir is not recommended during critical illness.